Okay, the recording has started. Let me pull the PowerPoint up and I'm going to focus on the things that you need to know. Chapter 8, care of patients with infections. So these are the objectives. You know, you must know the chain of infection, and I'm going to explain the chain of infection. And you have to be able to understand and explain how to interrupt the routes of transmission. We're going to go over specific transmission-based precautions. We're going to talk about your defense mechanisms, the principles of anti-infective medications, and what you have to do. What is your job as a nurse caring for a patient with an infection? Okay, so what we're going to talk about, let's go right to the chain. This is the chain of infection. Okay, the chain of infection starts off with an infectious agent. So what does that mean? An infectious agent is anything that can cause infection in a person. And the list of things that can cause infections is kind of long. So we call them pathogens, okay? And a pathogen can be a bacterium. So for example, Clostridium difficile, C. diff, that's a bacterium that is pathogenic. It can cause an infection. Pathogen can be a virus. Hello, corona, right? And that's one of many. Viral hepatitis A, hepatitis B, hepatitis C, viruses that are pathogenic. The flu, all the different strains of the flu, they are viruses, okay? So bacteria, viruses. Other things that can be pathogenic are things like molds, spores, fungi, which is the plural of fungus. All of these things have the potential to cause harm to a human being, okay? And so there's a chain that has to happen. Right now, we're all practicing social distancing. And the reason that we're doing that is because we understand that this particular virus, the coronavirus, is spread via droplet. And with droplets, you have 3 to 6 feet really, around you, that if someone laughs or spits when they talk or coughs or sneezes, the droplets, they're microscopic, you can't see them, they can spread and then they can hit you. And if you are immunocompromised in any way, or if you have any open areas, and we'll get into more detail about this later, then that makes you susceptible to catching that pathogen. That makes perfect sense, right? So let's take a look at this chain again, and this way try to help you understand it. So the infectious agent is the pathogen. The reservoir is where the pathogen is living. So if I had the coronavirus, I am the reservoir, right? There are some other viruses, for example, polio. Polio lives in still water, believe it or not. Polio is still out there, but nobody knows anybody that has it because we have immunizations, right? So the reservoir for polio is still water, like pools of water, sometimes lakes, those kinds of things. But nobody gets polio anymore because we get vaccinated. So the infectious agent, the reservoir, and then there's a portal of exit. How does that infectious agent get out of the reservoir? What's the exit? What's the doorway out? And so, for example, if I had corona, the coronavirus is the pathogen, I'm the reservoir. The portal of exit, when I cough, that's the portal of exit through my respiratory tract, right? Mode of transmission for this particular, if we're talking about the coronavirus, is droplet. And we're going to talk about the different types of transmission, standard precautions, or universal, droplet, airborne, and contact. And we'll get into detail about those, okay? So for this one, droplet. And then there's got to be a portal of entry. So when I, as the reservoir, cough, portal of exit, mode of transmission, droplet, how does it get into you? Well, if you're closer to me than 3 feet, it might just, the droplets could go right around your respiratory tract and they could go in through your oral mucosa, okay? Then that would make you possibly the susceptible host. What does that mean, susceptible host? It means that for most average, healthy, adult human beings, okay, you have hopefully a very good immune system. Okay, you got an immune system where you have white blood cells that will defend you. You have skin that is the first layer of defense that protects you from things getting in. That's why as nurses, we're always yelling and screaming, skin integrity, skin integrity, skin integrity. It's important because open areas are portals of entry, right? So a susceptible host is someone who is in some way compromised. Either they have an immune problem, their immune system's not working right. Maybe they're old, right? And I mean, I'm almost 60. Be quiet, don't tell anybody. But I'm in good health, you know, thankfully I'm in good health. But for most people, once they get past 55, 60 years old, other people, not me, the immune system starts to kind of age just like everything else, right? If you have a car and it's 10 years old, but it's only got 5,000 miles on it, car's probably in pretty good shape. But if you have a car that's 10 years old and it's got 200,000 miles on it, things are wearing out. Brakes are wearing out, right? All the timing belts, all the other things. Just like that with people. Our parts, as we age, start to slow down and wear out. So, and that includes our immune system. It gets older, can't work as well as it used to do. So elderly people are considered susceptible hosts. If somebody had HIV, which is human immunodeficiency virus, that would make them immunocompromised. So they would be susceptible, right? So there's a long list of potential susceptible hosts. And if that chain stays just the way we saw it, what happens is if I have whatever the disease is and you're susceptible and the chain is intact, then you get what I got, which is why so many people are contracting this COVID-19. Part of it has to do with a lack of understanding of the transmission and how to protect yourself, you know. So make sure that you understand the chain of transmission. If you have questions about it, like I said, jot them down. At the end of the lecture, you can ask me, okay? So that's the chain of transmission. Next, we will go to, this is a list of the things that can cause infection, these pathogens that I spoke of. Bacteria, virus, fungi. I'm not going to get into details, great details about protozoa, helminths, and prions, so don't worry about those, okay? I want you to worry about bacteria, right? Viruses, I'm going to talk about them, and fungi. They're the three most popular, okay? All right. And then don't worry about microbiota, but pathogen, make sure you understand what the diagnosis or what the definition of pathogen is. It's a disease-causing microbe, right? Any microbe that can make a person ill, that is a pathogen, okay? All right, next. So environmental homes for infectious agents, what does that mean? Animate and inanimate. Animate means things that are living. Inanimate means things that are not alive. So certain bacteria, viruses, fungi can live on animate things like people, insects. We know that, you know, ticks can carry Lyme's disease, etc. Animals can carry disease. Plants can even carry disease. But then inanimate, water, soil, medical devices, hard surfaces. So again, when we talk about the coronavirus, where you'll use that as an example, but this applies to any disease. If I have COVID-19 and my hygiene is poor and I cough right into my hand, Now the droplets are on my hand. And then I get up and I'm one of those older people that like needs to grab a hold of things. So I touch the table and I touch the doorknob. So the bacteria or the virus that was on my hand, the droplets on my hand, I have now spread them to the table, to the doorknob, and anything else that I touch for that matter. And viruses can live for a short period of time on inanimate objects, okay? They can't live forever. There's a gross misunderstanding of this. If I was HIV positive and I cut my finger and it was bleeding and I bled all over my table, and then 2.5, 3 hours later, someone came along, didn't realize that the blood was there, it's dried up now, and they touch it, are they going to get HIV? A virus is not an independent living thing, okay? A virus needs a host. So how many times have you ever gotten just a common cold, right? Which is a virus, and somebody tells you, don't worry about it, it's going to run its course, right? You've heard that expression, let it run its course. What that means is, and this applies to all viruses, a virus is self-limiting. Self-limiting. That means because it's not an independent living thing, a virus can only live for so long. It's going to run its course. It will be self-limiting and it will dissipate and die off. With COVID-19, the problem is that a lot of the people that are contracting it, because their immune response isn't great, they are not able to withstand the virus until it runs its course, and they die before it runs its course. Does that make sense to everybody? This is what's happening with the COVID-19, and that's the biggest problem. So they're going into respiratory failure before the virus has been able to run its course, sadly. Okay? So, let's talk about, all right, we're not going to get to that. All right, so when we talk about contact or droplet or airborne or how things are transmitted, things can be transmitted directly or they can be transmitted indirectly. Let me explain what I mean by that. So when we talk about direct, in other words, let's think about sexually transmitted diseases, right? Sexually transmitted diseases, chlamydia, syphilis, gonorrhea, all of those things are spread by sexual contact. In other words, direct contact. A person that's infected touches another person. That's direct contact. And then droplet, like I told you before, sneezing, coughing, talking, all of those things, the droplets can spew, and they're microscopic, from the infected person through the air, 3 to 6 feet. And please remember that, 3 to 6 feet. That's droplet, okay? All right. So prevention, I can't tell you this enough, okay? Couple of things. Number one, washing your hands. And I know that you hear us as nurses, wash your hands, sing happy birthday, row, row, row your boat, wash your hands, wash your hands. Washing your hands is the number one way to prevent the transmission of diseases, okay? I think one of the biggest issues that I have with people in general is how many of you guys, and just raise your hand, use hand sanitizer frequently, carry a bottle of hand sanitizer? How many of you carry hand sanitizer?
I hate it.
Okay, stop it. Stop it. Because do you want to know what you're doing with that overuse of hand sanitizer? You are actually disrupting the natural pH of your own protection in your hands. And when you come in contact with a pathogen, you are going to get so sick. Okay? In order for your immune system to work, There are memory cells, T lymphocytes, and we're going to get into the different kinds of white blood cells in a few minutes. In order for your immune system to work, it has to be exposed to some pathogens. You can't live in a bubble. If you live in a bubble, you disable your immune response. And the one time that you slip up and you don't have enough on or whatever, and a pathogen gets through, your body won't recognize it, won't know what to do, and you're going to get sick as a dog. Okay? See, I said dog just like everybody in Philly. Sick as a dog. So please refrain from the constant and persistent use of sanitizer. You don't need it. You're actually doing more harm than good. Okay? All right. So, personal protective equipment, and this is critically important for you guys to know and understand in relationship to the transmission of diseases. So, in other words, the PPE that you need is related to how the disease is transmitted. In other words, so let's talk about universal or standard precautions. We're going to start there. Let me see if I have a slide for that. Let me get to that. All right, so we're going to start with airborne. And there is a real easy way to remember airborne, and I'm going to explain what airborne is. Airborne transmission, we're going to start there. Just remember this one line. I want my MTV. And yeah, I'm going to do a lot of stupid, crazy stuff that's going to sound like I got Alzheimer's, but I don't, because it's going to help you remember when you see something, you're going to go, oh, the crazy lady's singing, I want my MTV. MTV stands for measles, tuberculosis, and varicella. Measles, tuberculosis, and varicella. MTV. Those are the 3 diseases that are airborne. Those are the 3 diseases that are airborne. Okay? That's it. Not the flu, not the corona, none of them. They're all droplet. The only 3 diseases that are transmitted airborne are MTV. Measles, tuberculosis, and varicella. And varicella, by the way, is the chicken pox. Okay? That's what it is. They are airborne. What does that mean? Well, that means that if I have tuberculosis, all I have to do is just be sitting here quietly breathing. That's it. I don't have to laugh. Why am I getting feedback on this? Make sure you got your mics off. Okay. All right. All I have to do is sit and breathe. It doesn't require droplets. Airborne means that the super microscopic disease particles that I have, say with measles, tuberculosis, or varicella, will be spread just by virtue of my breathing. And there's no limitation. I could be 50 feet from you, but if we're in the same room, let's say we're in a big banquet hall, if I have TB, guess what? Everybody in that room has now been exposed to it. Everybody. All I have to do is breathe. Okay? And we got a breather, we're dead. Okay? So airborne, MTV, measles, tuberculosis, varicella. What is the PPE that is required for airborne? And we're going to go over that right now. And these are the things that you need to know. High efficiency particulate respirators, also called fitted particulate respirators. I'm going to actually add a couple notes on here. Okay, so AKA, AKA fitted particulate respirators, also known as an N95. Okay, And I'm pretty sure that if you have at least looked on Facebook or seen the news, there's a huge shortage of N95 masks, which are high efficiency particulate respirators, very specific type of mask. And they're not just the masks that when you grab a mask out of a box, one size fits all. Nope. N95 masks, also known as fitted particulate respirators, are actually in sizes. They come in extra small, small, medium, large, and extra large. And you are fitted with them, okay? They do a test where they'll put the mask on you, and then the nurse will stand behind you and squeeze this little thing, and it lets out a puff of a very pungent odor. If you can smell that, then that means that thing doesn't fit you right. If you cannot smell it, then that fitted mask does fit you properly. Okay, so once you know your size, you will always say, listen, for N95 masks, I wear a medium, right? So that is a very specific type of mask. What other PPE do you need? Well, remember, the PPE that you need has to be the minimum to protect yourself and your patient. Somebody with an airborne disease, measles, tuberculosis, varicella, must be alone in a negative pressure isolation room. Negative pressure isolation room, okay? And what does that mean? The room actually has a special HEPA filter built into the exhaust, and it actually has kind of a fan that suctions the air out and into this filter so that the air from that room doesn't get into the general population of the hospital, okay? Because I told you with airborne, there's no 3 feet, 6 feet, 10 feet. It could be 100 feet. It's airborne, so it lives in the air, okay? So negative pressure isolation room. If the patient needs any type of diagnostic test, they need an x-ray. The ideal scenario is we get mobile x-ray to go to the patient's room. If we can't do that, then the patient must have a surgical mask on them, and you as the nurse must have an N95 mask on you. So if you're in the hospital and you see a patient getting transported down the hall and the nurse has an N95 on and the patient has a surgical mask, it's either measles, tuberculosis, or varicella. Airborne. Okay? Y'all with me so far? Okay, very good. Okay. So, airborne diseases, make sure you know what they are and make sure you understand the PPE that is necessary to protect you, okay? You never, ever, ever go into a patient's room without a fit tested respirator, and a surgical mask is not enough to protect you from inhaling the airborne pathogens, okay? You must have an N95. All right. And this is why I hate PowerPoints and I never use them. So we're going to, I want to talk about the different types of transmission and PPE that's needed. Okay, guess what? The heck with the PowerPoint, I'm just going to talk. All right, so that was airborne. When it comes to droplet 3 to 6 feet. And remember, if there's a question that says, your patient's been diagnosed with pneumococcal pneumonia, what type of transmission-based precautions must be used? You would say to yourself, well, it's not measles, it's not tuberculosis, and it's not varicella, but it is respiratory, so it's got to be droplet because it's not airborne. Respiratory diseases are transmitted either droplet or airborne. And the airborne diseases are MTV. So if it's not one of them, it's droplet. Okay, the flu, pneumonia, COVID-19, All the other coronaviruses, SARS, MERS, they're all transmitted via droplet. And so what you would need for droplet, surgical mask, Airborne N95 fitted mask, okay? Next, contact. So when we talk about contact precautions, we talk about things where either the person's urine or feces or blood or body fluid is infected, considered infectious. So for example, if somebody had, say, C. diff, Clostridium difficile, if anybody's ever been around a patient that has C. diff, you will know the smell is delightful. It is delightful. It's like roses and perfume, right? No, the smell is hideous. It smells unlike anything that I can even compare it to. C. diff, okay? And with C. diff, what's infectious? The feces, right? So the only thing that you need for personal protective equipment in this scenario, you need gloves. Now, if the patient has explosive diarrhea or you're washing out a bedpan, then you might need gloves and a gown and maybe a mask if you think it's going to splatter. But for contact precautions, what you absolutely must have are gloves. The rest of it is clinical judgment depending on the task that you're doing. Okay? And this is what I mean about, I say math is black and white, but science, there's a lot of what ifs. It's going to start making sense now, okay? Because if I am emptying a Foley, okay, and I know the patient has VRE, which is vancomycin-resistant enterococcus, and we'll talk about that later, but it's very infectious and it's in the urine, okay? If I'm emptying a Foley, probably just need gloves. If I have a crazy patient with Alzheimer's that's just peeing, he's peeing all over the room, I got to suit up, right? I need a gown. I probably need a mask, maybe goggles. So you have to say to yourself, what is the task that I'm doing? Patient has a wound, and the wound we find out has been infected with MRSA, methicillin-resistant Staph aureus, and I have to irrigate the wound. Irrigation, when you're irrigating it, there could be splatter. So now I know I'm going in there with gloves and a gown and goggles and a mask because I don't want that to splatter back in my eyes or my mouth. Ugh, right? So that's clinical judgment. You say to yourself, what is the task I'm about to perform? What type of infection does that patient have? How is it transmitted? And that tells me what I need to protect me. Is that making sense to everybody so far? Okay. And then last but not least, we have just standard precautions, universal precautions, which just means that if you are going to be in contact with any type of body fluid, you wear gloves. Now, if you're just coming in to take a set of vitals, please, for the love of God, don't wear gloves, okay? You don't need to wear gloves for someone that's just a regular patient, somebody who's in, with a cardiac or, COPD or a hip or whatever. If you wear more PPE than is required and more than any other caregiver is wearing, how do you think the patient's going to feel? So everybody else comes in with gloves on, and then you come in a hazmat suit and you got on a hat and booties and a gown and a mask. So the patient's going to go, oh my God, what don't I know? Am I dying? Right? So you have to consider the PPE that you wear is whatever's necessary to protect you and, of course, your other patients. And I can't stress the hand washing. How many times I have watched people go from a patient's room, take their gloves off, not wash their hands, and then go right to another patient's room and touch them. So you'll notice I don't do clinical rotations. There's a reason. I was in administration too long. When I watch people do those things, I get upset. So because what you're doing is you're taking whatever disease that patient had and potentially spreading it throughout the whole facility. right? And those people are all mostly elderly. At the very least, they're immunocompromised, right? Because they're in the facility for a reason. So wash your hands before you put gloves on, you wash your hands. And after you take your gloves off, you wash your hands. And that is critical, okay? And even the hand sanitizer, can you use it when you're in a facility? Of course you can, because facilities are just riddled with pathogens. All facilities, hospitals, nursing homes, rehabs, and even facilities like jails and prisons, those kinds of places. They are like petri dishes brewing with pathogens. So yes, use the hand sanitizer unless your hands are visibly soiled, or unless the patient has, say, C. diff. With C. diff, you must always use soap and water and wash your hands, okay? All right, so that's the different types of transmission-based precautions and the PPE that you need to go along with them. The next thing I want to talk about with regard to transmission in that chain of infection are two things, and they're called vectors and vehicles, okay? Vector, V-E-C-T-O-R. A vector is alive. It is alive. For example, a tick can actually transmit Lyme disease to a human, right? That tick is considered a vector. A mosquito. Mosquitoes can transmit a whole variety of diseases. Mosquitoes can transmit Zika. If y'all remember the Zika virus that was going around, they can transmit malaria. And so in that instance, that mosquito is the vector. A vector is something that is living, it's animate, it's alive, okay? And it has the ability to transmit a disease to human beings, okay? Then we have a vehicle. A vehicle is not a living thing. So here's an example. You go to a restaurant and you eat some, I don't know, you have a nice surf and turf dinner. And the person that prepared your meal had hepatitis A, which is transmitted oral fecal, and they didn't wash their hands after they used the restroom, and then they prepared your food. And then you ate that food. The food that you ate that then gave you the hepatitis A, which is, we can fix hepatitis A, by the way. A lot of people have it and don't even know they have it. But the hepatitis A that you got from the food. So the food was the vehicle. Does that make sense? Because food is not alive. Hopefully you're not eating anything that's alive. That's how this whole corona started in the first place. Eating things you ain't supposed to be eating. So, a vehicle is an inanimate, not living object that has the ability to transmit a disease. A vector is a living thing that can transmit a disease. Okay, we good so far? I am going to pause this recording. I like the thumbs up, thank you. Let me stop.